Can you tell me what cancer screenings should be prioritized for patients with IBD and why?
Yeah, yeah, absolutely. That we know that IBD patients are at certain risk for certain cancers, right? We all know about the colon cancer risk, but we also have to remember that they are likely on long-term immune suppression therapies. And so annual total body skin exams are important for those who are on the immunomodulators as well as biologics to find not just the melanomas, but the non-melanoma basal cell and squamous cell cancers. That skin exams, don't forget, should continue even after stopping thiopurines because of the ongoing long-term effect that that can have on the skin. Certainly, for folks who have Crohn's disease, there should be special attention to perianal exams during colonoscopy, and I would argue even in the clinic, just because we want to make sure that we are not missing any anal lesions. And then, again, the colon cancer, I think we're all very familiar with those surveillance guidelines, but don't forget about women who need cervical cancer screening, especially when they are on thiopurines. Not so much the biologics, but the thiopurines do increase the risk for cervical dysplasia. Freddie, I know that this is an area of interest of yours particularly, but what are the key vaccination recommendations for IBD patients, and how should we optimize their administration?
No, thank you. And thank you for that great summary. Yes. So vaccines are key, it's crucial for patients with IBD because some of these risks of vaccine preventable diseases are from just the disease itself or from the immune modifying therapies we're using. So this is definitely something we should be talking about with our patients, at every visit, especially if we're planning to start an immune modifying therapy. We never delay treatment to vaccinate, but
Okay.
it's something we have to think about. Is this an annual vaccine during respiratory season that we're talking about influenza? Are we recommending a high dose influenza vaccine for those adults who are older than 65? Now we have pneumococcal vaccine recommendations that we summarize here, where we now have a one and done pneumococcal vaccine strategy where we have two vaccines that are just one and done. Obviously, many people have heard about RSV and educating patients that, hey, RSV is a thing. This is something preventable. For now, it's just a one time vaccine, and especially herpes zoster. So herpes zoster is now recommended for adults who are at higher risk for herpes zoster associated with some therapies as starting at age 19. So our patients trust us. And I think having vaccine recommendations from their gastroenterology provider is important, even if you're not giving the vaccines in your clinic, making sure that you're talking about this, that they're safe, it's not associated with this disease flare is important for all providers. And in this CPU update, we definitely outline what you need to know.